evening, and thank you for joining the People's Assembly on 92.5 Enugu's Dream FM. The People's Assembly is all about human rights, governance, health, and accountability. It is a platform that aims to bridge the gap between government institutions and the people. In this assembly, you speak and we amplify your voice. My name is Ebele Idam, alongside my production crew led by Lutanna Okereke. Today is Monday, the 30th of January 2023. Time check is 5:09 p.m. Now, today is World Neglected Tropical Disease Day, and it is commemorated every year on the 30th of January. This day is set aside to create better awareness of the devastating impact of neglected tropical disease on the poorest populations around the world. The day is also an opportunity to call on everyone to support the growing momentum for the control, elimination, and eradication of these diseases. Also, the World Health Organization is calling on everyone, including leaders and communities, to confront inequalities that drive neglected tropical diseases and make bold, sustainable investments to free over 1 billion people who live in the most vulnerable communities from the cycle of poverty and are affected by these diseases. Now, there are diseases that exist and people rarely talk about them. So our focus this evening will be on Bruli, ulcer, and leprosy. And I have right here with me Dr. Ngozi Ekeke, public health physician and medical advisor with German Leprosy and Tuberculosis Relief Association and Ntd Nigeria. Good evening. Thank you for joining us.
Thank you very much. Good evening, listeners. My pleasure to have you listen to us this evening.
Okay, I also have right here with me Stella Ugu, project staff Ntd Nigeria. She would also be sharing her leprosy experience with us later on the program. Good evening, ma'am. Thank you for joining us.
Thank you very much, my sister.
Okay. All right, let me start with you, Dr. Ngozi Ekeke. Let's start our conversation with what neglected tropical disease is all about and what is the reason for its commemoration.
Yeah, thank you very much. Good evening again, listeners. Today is World Neglected Tropical Diseases Day, World NTDs Day, and among many things, we want to raise awareness. We want to talk about neglected tropical diseases. The World Health Organization has about 20 group of diseases which affect the poorest of the poor, especially in the tropics, which has not actually gained sufficient attention by stakeholders, the government, civil society, and other development partners as it should. Of course, there are different diseases, but then if you start something like malaria, HIV, tuberculosis, they don't fall under neglected tropical diseases because a lot of investment, global fund, so many partners are investing heavily on them. But then, when we talk about neglected tropical diseases, is the word neglected is there, because people are not paying much attention. Those who should care are not actually as much interested, and those who are suffering this include them the poorest people, is in the tropics, women and children. They suffer with all the debilitating consequences, and that is why today is important that we raise awareness and, by the way, end that neglect.
Okay, now you made mention of, you said 20.
Yes.
20 neglected tropical diseases. So we are looking at Bruli, ulcer, and leprosy. Now, aside from these two, what are other neglected diseases?
Yeah, we are even grateful that we have up to 2 out of 20 that we'll be talking about today. Let me talk about within our environment in Nigeria generally. Very commonly, we have leprosy, we have Bruli, ulcer, but you also have lymphatic filariasis. Where you see some people have very big limbs, they're swelling in their legs so big that they may not be able to use their shoe. Maybe one leg and the other leg is normal. And just like that, it just came that way. We call it lymphatic filariasis. Okay. Then we also have trachoma. especially in the north, maybe some part of Ebonyi state, is blindness, but that blindness, I don't want to say so many medical words. So we have trachoma is there. Then schistosomiasis is another condition where people go to urinate. They're urinating blood, especially children. And these things, they get transmitted that way, okay? Now, you also have commonly around here river blindness. River blindness is known. And some time ago, not so I think presently you have a lot of scabies. Those who grew up in the rural areas will know that there is this rashes on the finger webs that is very itchy. It's itchy and then bringing out some fluid, and the thing and it's sweet when people. I think I was in Bayelsa State. I got a new name for it. They call it sweetie, but that is scabies. And then you have again soil transmitted helminthiasis, where you have worms. Especially among small children, due to the sort of hygiene and all of that. And these have some serious health implications. So the list actually continues that way. We have other ones that are not so popular in this part of the world, like Chagas disease, but so we don't really bother much in Latin America. Leishmaniasis may not be so common in Nigeria, may have very few cases somewhere. But then the other ones I mentioned earlier are quite a long list that we have to deal with, and there are quite some neglect, over the people who are suffering from these things, and it shouldn't be so.
Okay, you are listening to the People's Assembly on 92.5 Enugu's Dream FM. Time check is 5:15 p.m. and today is World Neglected Tropical Diseases Day, and our focus this evening is on Bruley, ulcer and leprosy. I have Dr. Ngozi Ekeke right here with me, and he will be telling us more about these diseases, how it's what it is, how it can be prevented, and so much more. Now let's look at Bruley ulcer now. What exactly it is and why it is called Bruley ulcer.
Okay, it's interesting. Bruley ulcer, the name Buruli is the name of a town. Just like you are saying maybe Abakaliki, or you are saying Okigwe, or you are saying Umuahia, something like that. That is in Uganda. And some years ago, people were just observed that some people are having what we call ulcers in medicine, but wounds. And the wound was so peculiar and happening around a particular community, very common. So they didn't know what to call it. They said this is the wound that happens to people who are in Buruli. And because wounds in medical language is ulcer, so it became Buruli ulcer. So over time, it was now, medical research and all of that observed that this thing is actually caused by a bacteria. And that bacteria has a way of affecting the skin and producing a particular chemical that keeps, like an acid, keep itching up the skin that way. And if unchecked, can even get to the underlying tissues, the bone and everything, and get people disfigured. So Bruley ulcer had actually affected, we've seen people, especially younger people in this part of the world. But then before that discovery was made, it was also on record that in Australia, some cases were diagnosed. But because it's a developed world, and people had to do the needful. But in this part of the world, in Africa, in the tropics, this thing continued to devastate a lot of people. So, in a nutshell, Bruley ulcer, when you hear Bruley ulcer, is referring to a kind of skin problem that manifests largely as wounds. But then, it's also observed that it is not just wounds. Because before the wound came out, the first thing that appeared was something like a swelling. But the swelling is not painful. Somebody said, this swelling like a boil is not actually a boil, and I'm just carrying it around. Or maybe something like a whole limb got swollen up. Like a small girl I met somewhere in Amagunze, in Nkano West, playing around with all of that. And it's not painful. So either is the early stage of it, and over time the thing will just open up with a devastating, wound that way. And from there gets complicated. Some people have lost their limbs. They get amputated because it was so bad, it disfigured their arms or disfigured their feet. So, but overall, it is caused by that bacteria, and there are medications for it and it is actually treatable, especially
Okay.
if found on time.
Yeah, we'll get to that, including you would have to expatiate more on the signs and symptoms very shortly. But then, who is at risk of having this disease?
Interesting. For us in this part of the world, most people affected are usually younger people, especially children. But if you go to the developed countries like Australia, Japan, and all of that, it's more of adults. So maybe because of the level of the hygiene, the level standard of living is better, and all of that. So children and young people are more at risk. And again, those who walk or live around riverine areas, including little collection of water, maybe some ponds, stagnant water. Like now, this dry season, and people need to go to some places to get water. Even if it is within the town here, and people have to go and wash their clothes, So those people who live around there or have some activities around there are more at risk of getting brulee ulcer.
All right, you are listening to the People's Assembly on 92.5 Enugu's Dream FM. Today is World Neglected Tropical Diseases Day, and our focus this evening is on brulee ulcer and leprosy. The phone lines will be open shortly for you to join the conversation in case you have questions or contributions. 0902 0020 925 or 0809 8888 925. I have Dr. Ngozi Ekeke, public health physician and medical advisor with German Leprosy and Tuberculosis Relief Association and Red Aid Nigeria, as well as Stella Ugu, project staff, Red Aid Nigeria. She'll be sharing her leprosy experience with us later on the program. Stay right here. Today is World Neglected Tropical Diseases Day, and our focus this evening is on brulee ulcer and leprosy. I have Dr. Ngozi Ekeke, public health physician and medical advisor with German Leprosy and Tuberculosis Relief Association and Red Aid Nigeria, as well as Stella Ugu, project staff, Red Aid Nigeria. The phone lines are open for you to join the conversation. 0902 0020 925 or 0809 8888 925. Now, Dr. Ngozi Ekeke, let's look at symptoms now.
Okay.
Signs and symptoms associated with brulee ulcer.
All right, thank you very much. Let's put it this way so that somebody listening out there will get it clearly without using much of medical language, okay? Starts usually with a swelling like a boil. Can be any part of the body. And one thing unique about it that is not painful. And the thing is just there. And if nothing is done at that stage, at a point it will just burst open, becomes ulcerated, becomes a wound. And it affects mostly the lower limbs, that is the legs, the hands, and sometimes the body, but usually on the feet, and the lower part of the body, and as well as the hands. So suddenly the wound continues to get deeper and deeper, and yet is not as painful as one will expect. So you see this child carrying wound everywhere and playing around, and it's not that painful. When you see such a situation, this is very likely brulee ulcer, and that's why most times you see that people now they think it's a poison, they go to traditional healers and all of those things, because what kind of poison is this? And this devastating wound, chopping off the whole, skin, eating the skin, and the skin, and like that is not as painful as is expected to be. So these are some of those features, okay?
And would you say, is it related to leprosy?
Well, not really. The only thing that may appear as a relationship is that the bacteria happen to be a younger sibling in the family of mycobacteria, which is their great-grandfather. They have their different names. Leprosy is Mycobacterium leprae. Brulee ulcer is Mycobacterium ulcerans. So, as a matter of fact, it's like when people are born in the same family, but they're different individuals. So the same nature of apart from that, there are quite a lot of differences when it comes to leprosy, brulee ulcer. Like, for example, brulee ulcer is not known to pass from one person to the other. Okay, whereas leprosy can pass from one person to the other. Brucellosis may be there, giving very big wound, maybe on the surface of the hand or the feet, but that may not really be the case as much. May have some ulcers in leprosy, quite all right, but the mechanism may not really be the same. But one thing that brings all of them together, that they all fall under the category of those who are neglected, without getting much attention as they should get.
All right, 0902 0020925 or 0809 8888925. Those are the numbers to call to be part of our conversation this evening. Brucellosis ulcer and leprosy, that is our focus on the People's Assembly. In case you have questions or you want to contribute, go ahead and call us 0902 0020925 or 0809 8888925. Hello, good evening.
Good evening.
Good evening, ma'am.
Ebele.
Yes, Odazi.
Dr. Ngozi. Good evening. Listen, I spend most of my time in the coral area when I was working, along the west coast of Africa. And I noticed that there is this thing that happened. I think it has to do with deep ulcer on their face. And they say they march on some kind of juju. Not a bottle for I believe you understand Igbo very well. Not a bottle for Zonyoku. Everyone see me, they cannot put that. If they don't know, don't really hear them. And then they resort to traditional medicine. And how you show with it. Oh, okay, open there, look at you, that kind of thing. And you begin to wonder, number one. Number two, just this morning we heard about Lassa fever. And Lassa fever, from what your colleague told us earlier on, although only basic on Yanaba, Narumado, Obalana, careful game, don't $1, your colleagues. So educate our people in the core road area. Educate them and enlighten them. And we don't have medical facilities in our local areas. We don't have them. Our food game, tell them. God bless them. So the people, your Joe, I'm not a boy, I say no, or Zol, where they can be out. It's very common.
Okay.
But more often than not, they don't have means of communicating to talk about it. You can hear later. We see these small medical centers here and there. And I want antibiotics, they are going to put in the lot of awful. You could be few obstacles when radio station not Nanambra. I'm not sure. It's a radio station.
All right.
All
right, Odazi. Thank you. Thank you for your contribution. Thank you for your contribution on the program. Dr. Ngozi, I'd love for you to react to the call.
Yeah, I must appreciate that great comment as well as the question that followed. Just an assurance to give that on our part, we are so concerned that because the rural areas are also deeply affected. So what we have done in recent times is to train some young university graduates who are not employed, looking at the unemployment situation of the country. So we trained quite a number of them on neglected tropical diseases, both leprosy, brucellosis, scabies, and so many other ones. So that while they are in those communities, they are there moving around, creating awareness, showing pictures, and it has been yielding quite a lot. And right there, what we do is that they see these pictures, they suspect it could be borreliosa or it could be any of the neglected tropical diseases. They take a picture with the permission of the patient and sends to us. So the doctors, our team is always available to help them ask a few more questions to say, look, check out for this, for the other one. And at the end of the day, we guide them. Several patients have actually been detected this way early enough, and they've been helped. But at this World Ntd Day, we also want to make a humble appeal to the general public and other stakeholders, because we can't do everything alone. That just like Abel is doing a good job trying to create awareness, the school teachers out there, the religious leaders out there, the pattern medicine vendors, the chemists, ndị ụkọchukwu, onye ọbụla kwesịrị itinye ọnụ a na-ekwu maka ya, so that anybody who has any of these things, a swelling or a wound that is not painful, or maybe a whole hand or feet that just suddenly got swollen and they say it's poison, why not connect to any of us? In all the 774 local government areas we have in Nigeria, there is a leprosy and TB supervisor who will also oversee that of Brule ulcer. And you also have NTD coordinators in these places, and they are available. And the medications are there, and these people can actually be helped if they come early enough. So everybody should actually be involved now.
All right, this is the People's Assembly on 92.5 Enugu's Dream FM, and today's World Neglected Tropical Diseases Day, and our focus this evening is on Brule ulcer and leprosy. Stella Ogu, I'd love for you to share your story with us.
Thank you very much. I wanted to speak Igbo so that all the people outside us will be understanding what we are saying.
Okay, go ahead.
Okay. Experience m nwegoro na leprosy bụ na leprosy ada abịa na otu ụbọchị rekeshie mmadụ aka, kama na leprosy na-abịa dịka gasị na ụtụta ngwere na anwụga n'ụkwụ maọbụ n'aka maọbụ na ịzọrọ ọgwụ ụkwụ, dịka onye mbụ na-ekwu na ọ dịka ga-azọnye ọgwụ ụkwụ omebe gị ije gbagharịba. Ihe ahụ ga-abịa dịka gasị na ọ tara gị ụta ngwere, anọ ga-anwụ gị aka gị niile akwụsị ịrụ ọrụ dịka o si kwesị. Mgbe m na-emeche ya, mgbe m na-elegere onwe m anya, wee hụ na aka m niile na-anwụ anwụ na onwere ozi nke na-arụ ọrụ dịka o si kwesị, ka m weliri ihe oriri die n'ọnụ m, m ga-ahafụ, ọ ga-arapụ m daa n'ala, ọ ga-ada n'ala before, ma ọ bụ ka m welite afere ka nsa efere, ọ ga-ada n'ala before, nke na-egosi na aka m adrozi ike nke ijide ya nke ọma. M ga-agbara akpụkpọ n'ụkwụ, akpụkpọ adapụ m n'ụkwụ, m ga-amado na akpụkpọ adapụ m n'ụkwụ. Otu a ka o megidere m wee na-agbagharị ruo mgbe ihe anụnwa bidoro n'arọ 2010. Ya ka o bidoro ya, o wee na-eme m ya, wee gbagharịba wee rute na this health center. Chineke wee nyekwuru m aka, wee nyebe m ọgwụ ahụ. Otu a ka m ribere ọgwụ ahụ for 1 good year, wee nwere onwe m. Ya ọ bụrụ na o nwere ihe ọbụla na-enye gị nsogbu n'ime onwe gị, i wee na-eche na ọ bụ ụta ngwere enweghị ụta, kama na mgbe ahụ na-amalite otu a, malitekwa chọba ihe ga-eme ya, ọ bụrụ na ọ bụ n'ụkwụ gị niilego anya na ụkwụ gị adịghịzi ike dịka o si kwesị, lebekwa onwe gị anya, jụba ase gịnị ga-eme ka ụkwụ m dị ike. Ihe a bụ ihe m megidere, Chineke wee nyeziere m aka, wee bata na this organization, ha wee nyere m aka.
Okay. All right, you're listening to the People's Assembly on 92.5 Enugu's Dream FM, and I'd love for you, Dr. Ngozi, to summarize everything that she said.
Yeah, I think she even did a great job, and I must appreciate Stella for that narrative, because a person with lived experience, she was once diagnosed with leprosy and got that treatment. And part of the things that I appreciate in her story is that, when we see people with their limbs on their fingers are chopped off, we say, that's leprosy. And she's trying to say, no, not really so, because it doesn't just happen in a day, because her own experience started with some numbness. some tingle sensation, on her palms and the sole of the feet, and she couldn't really, understand what was really happening. And over time, she would want to hold something. The grip is very, very weak. She will put on slippers and walk around. The slippers will just fall off. So these are some of the symptoms. Sometimes we even begin to look out as is only for people who have their fingers chopped off. That's leprosy. Please, it's not leprosy. There's actually symptoms of neglected, or late detection of that. And the person to blame is not even the patient. The person to blame is the health worker, myself and my colleagues who are out there, because some of them actually came to us. But I will tell you one thing. Do you know? I was saying the other day, I went to collect PVC in one of the stations in town here in Enugu, and while I was there, there was a crowd and I was waiting for my turn. I saw a young man who just walked in, and looking at his face, I know that was leprosy. The hands were okay, the feet okay, very handsome young man. But this was just like bumps, all over the place. You see big rashes, what we may look at pimple. Somebody around me said, this is pimple, but I know it was not pimple. And I called him aside and asked him a few questions. The diagnosis of leprosy was made right there now. And he has gone to Enugu South, local government headquarters, and picked the medication, and he has commenced on treatment. So the point here is this, that symptoms of leprosy is more than just waiting for people whose fingers are chopped off. If you see that there is this numbness that you can't explain, or weakness in the hands, or you just get something to your feet and you can't really feel it, or maybe you see a patch on any part of your body that is different color, something is wrong, or see this thing like pimple that has been there for time, please come early enough so that we avoid unnecessary complications.
All right. Today is World Neglected Tropical Diseases Day, and our focus this evening is on Bruley ulcer and leprosy. There are a lot of diseases that we rarely talk about because we probably think that it doesn't exist, or, because it hasn't happened to me, why am I concerned? Whereas there are people who are really suffering from these diseases, and it's important that we create awareness about it so that everyone is aware of it. I have right here with me Dr. Ngozi Ekeke. He is a public health physician and medical advisor with German Leprosy and Tuberculosis Relief Association and Red Aid Nigeria, as well as Stella Ugu, who is a project staff with Red Aid Nigeria. Now let us continue with our conversation. All right, I think we have a call here. Hello, good evening.
Good evening.
Good evening. What's your name? Where are you calling us from?
My name is Chibezi. I'm calling from Moka.
All right, go ahead.
Please, I'm suffering from rheumatism. I'm having very painful. I want to know if there is any medication.
Okay, keep listening, Dr. Ngozi Ekeke will get to you, okay? Yes, good evening. What's your name? Where are you calling us from?
From Bo, not local government.
Okay, go ahead.
That is in Northern. Because catch on this.
Go ahead.
You can hear that them are the number.
Okay. All right, no problem. Keep listening. Dr. Ngozi will get back to you, okay? All right, 0902 0020925 or 0809 8888925. Hello.
Hello.
Good evening. What's your name? Where are you calling us from?
My name is Stephen from Sukan.
Okay, Stephen, go ahead.
Okay. I want to ask a question. Those you studio, do you mean that there is no poison that can affect person like that can cause a wound or unhealed wound or prolonged wound? If they say yes, I will say no. Peace is rampant in this world, and I'm witnessing it before.
Just let the phone lines be and get back to our guest in the studio, Dr. Ngozi Ekeke, public health physician and medical advisor with German Leprosy and Tuberculosis Relief Association and Red Aid Nigeria. Over to you, Doctor.
Thank you very much. I must appreciate Chibweze from Oka, Lewedim, and as well as Steven, who asked some questions. Now, for Chibweze, who has arthritis, my advice is that you get to the nearest hospital so that you get properly examined by a doctor, and then because it could be more than that, so that you get the best of attention, because your welfare is actually our concern, and we'll be very happy to know that you've done that, and you are in the best of state of health. Now, to Nlewedim, who also talked about phone number, I would give you, there's some good news here. If you take a walk to, I don't know the local government where serving your location, but just go to the local government headquarters. When you get there, ask them for leprosy or tuberculosis supervisor. There is somebody that's a desk officer there. We have trained people in all the LUGs, okay? And it's going to be free of charge, and the person would answer your questions and even get across to us, both in Enugu and the neighboring states. So just walk there, ask for tuberculosis and leprosy supervisor, and you get all the information that you might need. And then coming to the observation that Stephen made, asking, is it not possible that there are some, I'm putting in my own words now, that some of the wounds we are talking about were actually some jars and all that, much. Let me just put it this way. I appreciate your observations, sir. Even we're talking about brucellosis, there are so many things that can cause wounds, okay? Somebody may have diabetes that is poorly treated. It may also lead to some wounds. We'll have different types of wounds, every time. And our advice generally to people is that even if it is not brucellosis, a place like National Orthopedic Hospital, you get there, they are experts in handling the wounds. They'll be able to advise you, examine, and make diagnosis. But then, if it is advisable that you also check out, because it could be brucellosis. And if it is so, medications are free of charge and they are available to you, and it wouldn't take you anything. And if you come early enough, the same local government tuberculosis and leprosy supervisor will attend to you in that local government, and we'll be happy to serve you. That would be my response to that.
Okay, and finally, how can this be prevented?
Oh, beautiful. Let me start with leprosy. To prevent leprosy, the easiest, the most effective way is to dictate all the people who have leprosy as early as possible, put them on treatment, and leprosy is out. Okay, that's the easiest way. And we should not avoid anybody who has leprosy. There's no need for stigma, because it's not highly contagious as we fear. Other things like tuberculosis are highly contagious, Lassa fever and Ebola and all that, but leprosy is not. Okay, you can eat with person with leprosy, you can play around, sleep on the same, and there's no fear of anything. Okay, so, but what we do is help people who have some of those symptoms, maybe a little patch that you call eczema, come on time, because that could be leprosy. Okay, so if we find them on time and get them treated, we have preventing the transmission of leprosy. Now, for brucellosis, I said earlier, brucellosis is not yet established to be transmitted from one person to the other. But the greatest danger is to suffer some deformities that can even lead to amputation. So the best thing to do is still finding those who may have these things early enough. Finding maybe somebody who have a swelling that may not be painful, early enough, and all of that. Okay? So if I can just give you one quick example. I don't know, can you take that? Okay, fine. Some time ago in Anambra, along River Niger, in Obaru local government, a woman came after awareness. Said, doctor, look at this swelling on my foot, on top of the foot there. Just a swelling like a boil on top there, and he said it's not painful, nothing. I had to stick in a needle, collected the fluid for this, and the result came out that this is brucellosis. There was no need to open it, there was no need to do anything. I just started the medication. And before the medication even was completed, the whole thing resolved completely. But I have a picture of what it was and after that. So I was so happy about that, because we find out early enough. If that intervention didn't happen, that will open, and from there to the point it begin to eat up the skin around the feet, disfigure this person, may even lose the entire limb. So Prevention is finding the cases early enough.
All right, and finally, what role should relevant stakeholders, including the public, play in ensuring the elimination of neglected tropical diseases like brulee ulcer, leprosy, and the rest?
This is the most important question, Ebele, you've just asked here, and you are already on the job doing exactly what we desire civil society organizations to do. The media should actually help and create awareness about neglected tropical diseases. The school teachers out there, the women groups, the youth association, the market women, school teachers, religious leaders, and politicians, those in place of governance, policymakers, everyone has got a role to play. In fact, everybody listening to us this evening has got a role to play. Just look out for the person close to you. I said, do you have these symptoms? Please go to the nearest local government headquarters, look for tuberculosis leprosy supervisor to just check. And from there, the person can be helped. If all of us do this simple thing of helping, being our brother's keeper, helping one another, it will go a long way, get the message out there. The good news is that the medication and the treatment is free of charge and is available. And with that, it will no longer be neglected, and we'll all be happy for it.
All right. Thank you very much, Dr. Ngozi Ekeke, public health physician and medical advisor with German Leprosy and Tuberculosis Relief Association and Red Aid Nigeria. Thank you for being part of our conversation this evening. My pleasure. As well as Stella Ogu, project staff, Red Aid Nigeria. Thank you for sharing your story with us. And that's it on today's edition of the People's Assembly. Thanks to my producer, Lutanna Okereke. My name is Ebele Idam. And